Hi, my name's Jessica and I'm going to be your nurse. I'm going to have you verify your name and date of birth to me. And I've got orders from the doctor to administer 5 milligrams of morphine. And at that time, I would go ahead and explain describe the medication to the patient, and I would tell them about that it's an opioid analgesic derivative, and that the side effects are low respiratory rate, constipation, and sedation, and that the contraindications are respiratory disorders. And I would, at that point, go ahead and document or verify that I've got the right patient, the right drug, the right dose, the right time, the right route, and documentation. And then I would go to the med room and go ahead and start getting my medication set up. So I'm going to perform hand hygiene. Okay, so I would have done my dosage calculation and it comes to 0.5 milliliters, and I'm going to go ahead and get that. I'm going to mop the top. Trash can's over there. And get my syringe ready. Okay, when I've gotten all the air out, now I'm going to do the scoop method. And now it's ready to take to the patient's room. And I will be administering this at I will be administering 0.125 milliliters every 15 seconds for about a 1 to 2 minute period. And now I'm in the patient's room. I will remove my gloves, perform hand hygiene, and go ahead and do this all over again, but for time's sake, we're not going to do that. So then I'm going to scrub the hub, and I will take my saline and get it set up here and retract for blood return to make sure that there's good IV placement, which there is, and then inject the saline. We're saving all these for practice purposes. And then at that time I will go ahead and administer the morphine at 15 seconds for a 1 to 2 minute period. Okay. And then I will throw this in the sharps, which I don't know if we really are right now. Can I go ahead and do it? Because we're okay now. Okay. You're still practicing with it. Okay. And then I will infuse the next saline, the final saline flush, at the same rate as I did the morphine, to make sure that we don't have any issues or weird tastes in the mouth. Okay, and at that time, during this time, I also would like to note that I would look at the IV site to make sure that it's free of redness and pain or swelling, and I forgot to mention that. So in about 30 minutes, I'll come back and check on the patient to make sure that they're okay, they're not having any respiratory problems, and I will document. During that time, I will document according to the facility standards.